And we have today Dr. Nizar Bahabri. He is both American and Canadian board certified in internal medicine and infectious disease. He is the director of the academic affair of Dr. Faqih Hospital in Jeddah, one of the old and up-to-date tertiary private care center in Saudi Arabia. He's also the director of the Western region for the Saudi Society of Infectious Disease and Clinical Microbiology. He will present about the Saudi experience in management of HIV patient.
Good afternoon, everyone. Bismillah ar-Rahman ar-Rahim. Wassalatu wassalamu ala Rasulillah. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatan min lisani yafqahu qawli. I really would like to thank the organizing committee headed by Dr. Manaf. Really, he did a tremendous job. Thank you for Bahrain. Thank you for everyone who worked hard in this conference. Really, I would like to thank the society, which I am their son, for participating in this kind of event. And I hope that I will give you a couple of minutes about HIV, the new one. HIV in Saudi Arabia, the Saudi experience. So I hope everything works well. Inshallah. Okay, I hope everything works well. So I was asked to present about HIV. I know it's not easy to talk about sexually transmitted disease. I'm going to have a lot of sex in my presentation or sexual talk. I really apologize for all of you. I apologize also for more of my respect to the people that are being shown in the videos. So please bear with me. So today I was asked to speak about HIV, epidemiology, transmission, diagnosis, physical exam, diagnosis by lab, and treatment, and the media experience in Saudi Arabia, all in 25 minutes. And this is mission impossible. But I am like Tom Cruise, I can do anything. So I will try to do it in 25 minutes. So let's start. We'll start first by epidemiology. Epidemiology, this is the epidemiology of HIV in Saudi Arabia. As you can see, this is not an empty slide. This is it. We have none. The presentation is done. I'm good. We don't have HIV. I do not know why did they talk to me. They want me to present about HIV. We don't have it. This is according to the WHO. We don't have, you see? We don't have anything. We are white country. We don't have HIV patient. Nothing. Nothing is there. We do not do sex. We don't have anything. Even the children comes from God, so you don't have to worry about anything. So in 2010, WHO came and said the MENA group, which is the whole Muslim countries, are in warning because the curve is going up. What did we do in 2010? The people from Africa said, no, the bad people in the Gulf states, they are having a lot of sex. We are not doing it. The Gulf states said, no, 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 they are the ones who are free. So we blamed each other, but the curve went up. Then if you cannot see, this is unfortunate, but you cannot see this thing. But if you can see, the world is distributed into different areas. The areas that have a curve going up, do you see it? Very good. I do not know if the pointer is showing anything, but if it's not, this is it. It's us, 2011. No, we didn't believe them. 2012, they did it in blue. Maybe we cannot see red. So they did it in blue. There is one curve is going up. This is it. It's us again. We are scoring high. Congratulations. We kept on saying, we don't have it, and now the curve is going up. I don't know how. We don't have sex. Anyway, Saudi Arabia published its data in 2013, saying up to 2010, the numbers are going up. And this was a shock. How? And for the first time, we were saying, you know, more Saudis, the curving is going in Saudis is more. And this is the first lesson we learned. We never said that we have it until we do have it. And this is last year. Last year, the new number of HIV patients newly diagnosed Saudis is increased by 25% from 2012. So 2013, we had a 25% increase in the new cases in 1 year compared to 2012. And this was a big news. But because they put it in numbers, nobody looked at this 26%. So first lesson to be learned is if we want to treat what we were doing about HIV is not working. Not working. The numbers are increasing. We have to be realistic and we have to speak about it. And this is why I'm always being invited in Saudi to talk about HIV, because I like to talk about sex-related infection, not sex-related infection. I am a married man, and that's it. So transmission. So our first mistake, we said there is none. There is no HIV. The second one is in transmission. And unfortunately, we have very bad attitude toward transmission. So what Saudis know about transmission, we kept on telling them, don't do it. Don't do it. It can be transmitted. So people have the transmission of HIV that can be transmitted by cough or by anything. And it doesn't work. But my worst nightmare, I am a big fan of Twitter. And Twitter, I get this is my daily question. My daily story is kissing. I am the leader of kissing in the kingdom. I know all the stories of kissing. Because kissing in people's mind can transmit HIV, so I heard all the kissing stories, all of them. So this is one of the things that I got. This is a female who had a kiss like 3 years back, and she wants to get married, and she's worried about that kiss, maybe HIV related. And she's worried because we have mandatory HIV testing before marriage. And they kept on telling her it will not be transmitted. And then people tell me, no, I had the kiss. So I heard all of the kind of kisses. My famous one is the kiss. It will always start with the same story. I kissed someone forcefully. It was a forceful kiss. And then I will tell him nothing. And then he will tell me, but saliva was with the kiss. And I will tell him it will not transmit. And then he will say, but you know, I injured her lip. Her lip was dry. And I don't know why people always have dry kisses in the stories. Dry lips, always. And they said nothing will happen from her blood. It will go to your stomach. And then he will tell you, no. And also I had blood. So it's a bloody kiss. Now she have blood, he have blood, and they are continuing this kiss, and he is asking if this will transmit HIV. So I heard all of the things about kissing, and I want to tell you, how did we get this kissing thing? How did it happen? And this is how it happened. I hope it works, because you have to know everything. We are in a scientific meeting. Can we check if the voice will work? I'm really sorry. It doesn't look like it's going to work. I'm so sad. OK. So I'm really sorry. It's fine. I wish that we used my computer. But anyway, it's very interesting. This is the most famous video section in YouTube about a very famous show. This is one of the most famous رجال الدعوة في السعودية. He's a very famous, great guy who went and he interviewed a guy who had HIV. And he will tell him, I met a lady in the kingdom, and I kissed her one kiss. She had dry lips, and I kissed her one kiss. And so he asked him, only one kiss? And he said, yes, one kiss. And then it comes into the video, one kiss, one kiss, one kiss. So this is why we have the kissing problem in the questions. So unfortunately, media really played bad. And I did a questionnaire. This is unpublished data of 3,000 people plus in Saudi Arabia, university graduates, asking them if you think that mosquitoes will transmit HIV. More than 43% of the population said yes, mosquitoes will transmit HIV. And this is why this is our second thing to say, how deficient is HIV education in Saudi Arabia. And it really participated a lot, I believe, in the transmission of HIV. So just to review everyone, if you don't know, please, if you are in the hall, mosquitoes, do not do it, OK? Saliva, do not do it. So please, no saliva, no, nothing with the saliva, nothing from the mouth, from the cup or from the spoon. No public toilet will transmit HIV. And blood, there is this conception about blood. So I went to jail, and people will will injure themselves, and they will tell the policeman when they want to escape, we have HIV, and they will throw blood on them. Okay? It does not work like this. Okay? We all know it does not work like this. Please, it does not work even if you collected blood in your hand and you don't have injury, it will not be transmitted. So not every blood from HIV patient will transmit it. So this is for also part of education, because unfortunately we lack education in physician, in the medical field. And we have the first people can really diagnose HIV in Saudi are usually the dermatologist or the gynecologist, because they will see all of those physical exams. We diagnose a lot of patients based on their HSV status. So they will come with a severe herpes infection. And then when you do HIV, when you train yourself to do HIV testing for them, you will discover a lot of cases. Some of the young people will come with psoriasis that does not respond well to medical treatment, and they are not known with psoriasis. A lot of them, they will come with warts, with molluscum contagiosum, and molluscum contagiosum, you should do an HIV test. This is an HIV test until proven otherwise. And this is why it's really very difficult if you do not do it. And you should do an HIV test. Mainly if you want to discover cases, you should keep it in mind, and you can do it to any patient that you want, because it can be a test that will save his life. Testing in transmission, this is my second usual continuous question. So I get this in Twitter in literally 3 to 4 times a day. And it's always the same question, if this is conclusive or not, if this testing is conclusive or not. And this had a little bit of change in the guidelines. So this is a couple of things. So in day 7 to 14, if you did a viral load, you are going to be able to discover HIV in up to 95%. But remember, it's not a way of diagnosis doing a viral load. If you do a P24 on day number 16, you are being able to pick around 95% of people. And in Saudi, because they go to private labs, they will do everything for them. And they will tell them, when I can repeat it again, after 2 weeks. So I have patients who will spend around 160 dinars, 16,000 riyals or more just on testing, because they go and test again and again and again, and the lab will tell them, oh, you want to make sure? Come again next month. And they will keep on getting them every month doing this test. And in day 28, the HIV antibody can be positive in 95%, especially in the 4th generation. And in day 90, it's up to 99.97. So this should be taken into consideration if you are trying to screen patients, especially after exposure or after a sexual encounter. So this is new. We usually, in the 3rd generation of tests, we used to do antibodies. If it's positive, we have to confirm with Western blot. This was changed. If you have a 4th generation test, then you can do only the antibodies. You don't need to send for Western blot. If it's positive, it's positive. And you can proceed to do viral load or your CD4 if you want to confirm. You don't have to do a confirmatory test. This was accepted by different society, but not all of them. But we are doing it in Saudi Arabia, and in our hospital, we got the 4th generation because it's like a huge demand in doing the test. So if you got a positive patient, then you will do different testing depending on the test. I divide them into 3. First, you will do tests that are related to the disease, which are usually the HIV antibody, CD4, viral load, and genotype. And in a lot of centers in Saudi Arabia, we do have genotype, and we do follow the recommendation that says we will send genotype from the first time. Not usually as the European societies, but some of the US societies will advise for it, and we usually do send genotype in our first visit. Workup related to the medication, so you usually do your CBC, LFTs, renal function, and lipid profile, and workup related to opportunistic infection, and those are usually your syphilis, your crypto, antigenemia, your toxo, PPD test, gonorrhea and chlamydia and hepatitis, and the chest X-ray. Alhamdulillah, we managed to do in our centers most of them when we want to start treatment on patient. We have the facility to have all of this test, thank God, and we are able to send it before we start patient on treatment. So, treatment. And this is one of the main parts of the thing that everyone should know in the medical field. Treatment is really great. If you ask me, one of my best diseases to treat is HIV. I know a lot of psychology related to HIV but in the kingdom, but also it's very good to try to treat it because it does, the treatment really works very well. The treatments are amazing in my opinion. They really can change the patient's life. We used to have this, do we start early, do we start late, and every part of it, if you start early, now everything is in favor of starting early. You will have better potency, you will have less toxicity, you will decrease the emergence of resistance, you will have a lot of risk of decreasing transmission, which is very important in our country because a lot of males are married and they can be transmitting it to their wives, and this really medication really help. It helps really in decreasing the risk of complication, including nephropathy, including liver disease, cardiovascular disease, decreasing malignancy chances, degenerative diseases. All of this can be decreased if you start treatment early. If you delay treatment, it really does not help and you can wait for complication. And really treatment guidelines have been changed over the past couple of years, favoring a lot of early treatment. And in Saudi, in two main centers, especially I can speak about the Western region, we really start patients early. We start them, we really have hard time not to start. We will think a lot of time not to start because most of them, we will start as soon as possible. At least if we put in our mind that we will decrease transmission and we will let the patient well. They are very happy that they know that there is treatment. And I just put those things that, like if you look at the DHHS guidelines, how did they change over only a couple of years until they consider a lot of more than 500 to be considered for treatment. And you can treat anyone in their guidelines. And this was also changed in a lot, including the European guidelines in 2012, really made the 350 now is universal, including the WHO. The 200 is a very old information. The 350 is the acceptable one. Anything above it is acceptable. We usually try to treat anywhere. Any CD4, we will start to treat. And more than 500 is not our cutoff guideline. The treatment is free, and we have really the most advanced medication that can be used for HIV treatment. We all have it in the country. It's variable between hospitals, but most of the centers do really have the first-line therapies. And the first-line therapy is very useful, especially if you keep in mind that it will decrease the transmission. And this is really the most painful part of HIV in Saudi Arabia. That until now, unfortunately, we still have 50 to 70 children usually being born with HIV because their mother are not known, and the HIV testing is not mandatory for pregnant ladies. And always I like this graph to keep in mind starting early treatment, especially even in the last 11 hours before delivery, it can decrease the transmission up to 7%, and using it for 3 months can really drop the transmission significantly. And because of our society is a big debate, should they get married to someone, if he is an HIV patient, can he get married to a non-HIV patient? Can he get married to someone who is negative? And we have all the rules are against the HIV patients. HIV patients in Saudi, males are 5 to 1 female. That means those people will not get married. Unfortunately, the fatwa is not agreeing on it, neither the community. The community always hit me in presentation when I ever say that it's allowed. We are helping some of them to get married, especially if the females agree. And it's based on a very, very well-respected trial, well-known, that even it helped us in treating early patients who are married, the HPTN 052, which shows really if you start early, you will decrease transmission significantly by 96%. You can see the two groups. In the group that was treated, the transmission happened to one only person. The second group happened to 27 people in the second group. And as you all know, I had also another video, unfortunately, here to say, but we have different areas that the antiretroviral will work. We have more than 26 medication to treat HIV. We have the first line, which are now being, and I simplified into this one, mainly Truvada in the middle, and you can add to it, depending on the patient situation and compliance, you can add efavirenz, which is 1 pill, 1 a day, the Atripla, and we have 2 now, 1 tablet, 1 a day in the kingdom. And we can also add Darunavir or Raltegravir. Raltegravir is also there in the kingdom, and we are, if you ask us, the people who treat HIV patients in Saudi, we are really happy about the medication availability, and we can play with all of those medications to give the best to our patient. But the main thing is education. It's public awareness, and this was my challenge over the past 4 years working with the Saudi society. And we are honored to have innovative idea. We started talking to young people about HIV, and we used every kind of media thing that we had, and we've used every kind of way to deliver HIV. One of them was last month. We held like 900 people in an auditorium, in a hall. We got them stand-up comedian, singers, rap singers, and everyone was coming just for the event of seeing stand-up comedy. And then all of a sudden they found me on the stage. We closed the doors and we said, I'm going to teach you about HIV. And after I taught them about HIV and I told them everything is wrong that you know, we are closing the doors now. Under every one of you, under his chair, you have a rapid test for HIV. Now you test yourself. And we have people escaping from the doors, and we closed the doors significantly. We said, you go back, you test yourself now. And everyone went back, and after you test yourself, you have a light stick that you will just break to show the light that I did the test, I am not worried about HIV. And we had great pictures. I couldn't get it for you. But we've done a lot of campaigns. We went into different areas trying to convince people about testing. We did the testing without any name. I don't know anything about them. And we usually goes to the mall, and we will have like people are gushing from 4 to 12 p.m. just want there to be tested. And everyone, I got a very nice story. The security guy, he came and he said, Doctor, what are you testing? I said, why? He said, we usually have campaigns here, but your campaign is really strange. People, after they get tested, they go outside the mall, they have hugs, and they pray. What do they test for? Why are they so happy? They couldn't tell me that. And they said that there is a lot of love outside the mall. And people are congratulating themselves. I never saw prayer. Even people are praying in a different way from Mecca. Praying, just thanking God. And this is really strange. What exactly are you educating for? I said, we just do HIV testing. And then everyone became interested in the mall. And everyone then, I had females and males, and everyone you will ask him, did you have sex? No. It's just I want to make sure. Maybe I went to the barber shop one day. And you will have these stories of cat jumped on them. I will just end up by, we were honored in the Saudi society to sponsor this YouTube guys who are very well educated. I wanted to end up with their song. This had more than 1 million hits from Saudi, more than 800,000 hits, watching about HIV and education, and it had a rap song in the end of it, but unfortunately it cannot work over here. I wanted to end my presentation with a song. Thank you very much for the invitation. I hope you learned something. Thank you very much.